Here at Jefferson Healthcare, we continue to expand our testing capacity for COVID-19. Early on in the pandemic, we didn't have the opportunity to test everyone we would have liked to because of a lack of test kits and lack of resources. However, things have changed, and if you are having symptoms such as fever, chills, body aches, difficulty breathing, new cough or worsening cough, or the loss of your sense of taste or smell, please call our nurse hotline at area code 360-344-3094. When you call the nurse consult line, the nurse will review symptoms with you and help decide the best path forward and if you should be tested for COVID-19. Patients with mild symptoms will usually be scheduled in the drive-thru. For those who need more assessment, the respiratory evaluation station is available where the patient can be seen in an isolated setting. The consult line is answered 7 days a week from 8 to 5 p.m. These nurses are great, and if you get the voicemail, leave a message and they are able to call you back quickly. Our drive-thru testing is where a lot of our specimens are collected. This is a site that we use for people who are having milder symptoms or need screening before a surgery or procedure. Also, the health department sometimes wants people tested because they've had contact with someone who has COVID-19 and may not have many symptoms. This is a great site for patients because it's convenient and safe and isolated, and it also allows us to conserve our protective equipment. Results can be expected in about 48 hours as the specimens are sent to the University of Washington each evening. Specimens are a lot easier to collect and a lot more comfortable for the patient now. Whether you're scheduled at the drive-thru testing or you are scheduled at the respiratory evaluation station, know that most specimens can be obtained from the front part of your nose, which is a lot more comfortable. It's really important that we continue our testing program. As our community moves forward through this pandemic, one of the ways we know how we're doing as a community is to know how much disease is prevalent. By doing testing for people who have symptoms, even if they're mild, we can also do contact tracing and identify people who are at risk of exposure. Our testing program is an important part of Jefferson County moving forward through this pandemic. When we test, we know how prevalent a disease is in our community, and we can identify people maybe early in their disease and identify who they've been in contact with and try to keep people safe. So please continue to do the good work you've been doing, whether it's been physically distancing or wearing your mask. We really appreciate all the work that you've done to keep healthcare workers safe and to keep yourselves safe.